Ready to talk about perimenopause? Confused about what's hormone related and what's just aging? Hi, it's Brain Bites with me, Dr. B. I'm Jessica Beachkofsky, your friendly online psychiatrist. Let's dig in. Have you ever wondered if your brain fog, sudden mood swings, or thinning hair are just signs of getting older, or if they're actually your hormones causing havoc? You're not alone. But the problem is, it can be tricky to figure out what's caused by perimenopause and what's just a normal part of aging. Today, I'm here to quickly break it down for you. In this video, we'll dig into some of the symptoms at least 75% of women face during this stage of life, separating what's hormonal from what's just your body's natural progression. Get ready to feel more empowered and take control of your health, mental and otherwise. In this video, I'll often use the term women to discuss people born with a uterus and/or ovaries, as they are the group most commonly affected by perimenopause and menopause. However, I want to acknowledge that not everyone with these biological traits identifies as a woman, and not all those identifying as women experience menopause. While I'll use women for simplicity and clarity, this information is meant for anyone navigating the hormonal changes associated with this life stage, regardless of how they identify. So today, we're on to a topic that can feel a little or very confusing. Figuring out those annoying or downright terrible symptoms you've been dealing with, whether they're caused by hormones or if they're just a part of getting older. To make this fun, and let's face it, perimenopause could use some fun, I've turned it into a little game we're calling Hormones Raging or It's Just Aging. Here's how it works. I'll share a symptom and you get to guess. Is it caused by hormonal changes during perimenopause or menopause, or is it more likely to be related to normal aging? I'll give you a moment to think about your answer before I reveal the truth and share some science to back it up. But a game, this seems kind of dumb. It's really because I want to keep this light and engaging while delivering real, useful information. Whether you're in the middle of this transition, prepping for it, or just trying to understand what's going on with someone you care about, this is all about helping you feel informed and empowered. So let's get ready to play Hormones Raging or It's Just Aging. First up, vaginal dryness. Is this a hormone-related issue or just one of those things that comes with age? Pause and think about it. If you said hormonal, you're absolutely right. Vaginal dryness is directly linked to declining estrogen levels. As estrogen drops, it leads to thinning and drying of vaginal tissues, which can cause discomfort. But don't worry, because this is something we can treat. Next one, hot flashes and night sweats. Hormones raging or just aging? What do you think? This one's an easy win for hormones. Hot flashes or flushes and night sweats are also called vasomotor symptoms and are classic signs of perimenopause. Up to 80% of women experience them. And yes, they are directly tied to fluctuating estrogen levels. How about irregular or heavy periods, hormones or aging? If you guessed hormonal, you're on a roll. Irregular periods are another classic sign of perimenopause, caused by fluctuating hormone levels, including estrogen and FSH, or follicle-stimulating hormone. This can mean changes in patterns, timing, and flow of your period. Think of it as your ovaries' way of saying, we're almost done here. All right, let's talk about decreased libido. Hormones raging or it's just aging? Pause to think. Yep, it's hormonal. Reduced levels of estrogen and testosterone during perimenopause can lead to a dip in sex drive. It's not just in your head, it's in your hormones. But don't use your partner's testosterone. Women only need a fraction of what men do. What about weight gain or a widening middle? Raging or aging? This one isn't as clear. There are definitely major age-related metabolic changes playing a part here. But hormonal shifts can sometimes lead to weight gain, particularly increased abdominal fat. Okay, what about hair loss? Hormones raging or it's just aging? Trick question, it's both. Hormone changes can contribute, especially during menopause, but hair loss is also tied to aging and genetics, as well as other medical conditions. If you're noticing thinning hair, it's worth chatting with your doctor to see what's going on. Now, here's a big one that I see a lot of: brain fog. That why am I in this room feeling? Hormones or aging? Ding, ding, ding. It's hormonal. Many women report cognitive changes like memory lapses or trouble focusing during perimenopause. Those fluctuating hormones, especially estrogen, play a big role in brain health. But problems with memory and word finding are more of a function of aging. Unfortunately, either way, hormone therapy usually won't magically fix this stuff. All right, let's talk about skin changes and wrinkles. Hormones raging or it's just aging? This one leads more towards typical aging. Wrinkles and skin changes are mostly caused by aging and environmental factors like sun exposure. However, declining estrogen can play a small supporting role by reducing skin elasticity, especially down there, the vagina and vulva. How about some scary medical concerns like increased risk of osteoporosis or fractures and cardiovascular disease? Raging or aging? Lower estrogen levels definitely accelerate bone density loss, increasing the risk of osteoporosis and fractures. And the decline in estrogen's protective effects in the body can lead to negative changes in cardiovascular health, elevating the risk of heart disease. Ready for the next one? All right. Insomnia, raging or aging? Yep. Hormones play another big impact here. Hormonal shifts during perimenopause can mess with your sleep cycles. And especially when combined with night sweats, panic, or anxiety, it's no wonder so many women struggle to get a good night's rest. All right. How about unwanted hair growth? Hormones raging or it's just aging? This one's another combo. Hormonal changes during menopause can trigger extra facial hair, but aging and genetics play a major role. Basically, it's the universe keeping you on your toes and your tweezers busy. Let's end on an emotional note: depression and anxiety. Hormones raging or it's just aging? This one's hormonal. Women are at a higher risk for mood disorders during perimenopause because hormonal fluctuations affect brain chemicals like serotonin. You may have already struggled with depression or anxiety, but the chaotic hormone changes during this time can make everything worse. And because hormonal changes can affect mood regulation, it can also lead to increased irritability and anger. Make sure when you talk to your provider, you also bring up any other perimenopause symptoms because this may impact treatment options and you could end up getting better results. Wow, that was a lot of hormones and aging in just a few minutes. And no, this is not an excuse to blame everything you go through in midlife on perimenopause. And it also doesn't mean you need a prescription for a bunch of hormones to fix everything. Hopefully, this game helped you sort through what's happening in a perimenopausal body. And remember, all women who live long enough will go through menopause. If you're struggling with these symptoms, you are not alone, and there are solutions. I hope your brain is full of perimenopausal information. No extra hormones required. Be sure to grab more tasty tidbits. Be sure to grab more tasty tidbits at brainbiteswithdrb.com. Enjoy.